Welcome back to Uncharted Narratives. Today's guest, Jasmine Bonder, a critical care nurse practitioner who leads clinical innovations with creativity and purpose. Jasmine's multifaceted career spans direct patient care, entrepreneurship, and angel investing in healthcare startups. She'll share insights on the vital role of mentorship, the importance of emotional well-being in high-stress medical settings, and how nurses are uniquely positioned as problem solvers and operational leaders. Jasmine is a strong advocate for recognizing the economic value of nursing and encouraging nurses to market themselves as innovators. This episode offers a deep dive into healthcare innovation, nurse leadership, and the future of nursing beyond traditional roles. Stay tuned for a truly empowering and thought-provoking discussion.
Hi, Jasmine. We make it. You with me right now. How's it going?
Oh my God, what a day. Happy Thursday.
It's a pleasure having you with me and with my audience today. So, Jasmine, you have diverse background. You play different hat and role. We will get onto those all hats. But right now, I will give you the mic. So feel free to introduce yourself in the way how you want.
Yeah, absolutely. And thank you again for having me. I'm Dr. Jasmine Bonder. I'm a critical care nurse practitioner. I'm also head of clinical innovations for Moldco. I've worn so many hats in my life where I have been an entrepreneur, I've been an innovator, I've been a nurse practitioner, I've been a nurse. So I've had the privilege to wear all those hats in everything I've done.
Yeah, wonderful. Yeah, your profile and your LinkedIn was very interesting, to be honest. And I believe you have a lot of history to tell. Every time I'm surprised and see a new experience with other nurses. Every time I thought I came across all the nurses what they can do, but you are one of the few who give me a new lesson. So I will mention where for my audience, I see this is something new and it's not easy to have that hat being on the corporate level. I know how it's difficult. So here, every time we hear Jasmine from bedside to boardroom, and
Literally.
it is right every time. But for you, more about your journey about innovation and investment. So if you have held role as a nurse, a practitioner, hospital administration, professors,
Yeah.
and now you are head of clinical innovation. So what lessons have you learned from each of those roles and how they inform your current job or your current work? Whatever what you are working right now.
Yeah, right, right. And I mean, I think you and I have such similar journeys. ICU nurse, ICU or ER nurse, love that type of volatility, love on the spot thinking, how to handle critical situations, how to really build on that too. Like where there are challenges, there's just so much opportunity. And as nurses, we see that constantly, all day. Like all day, you're putting out fires, whether it's physical, mental, social, or just operational. You're always doing that. So it was like such a privilege in my life to work in like an urban downtown emergency room. And that was paper charting. Like when I started, we were paper charting. And then, 12 years later, I look at my career and I'm like, oh my God, I've seen every which way to do things, how to do things, how to manage things. And so I really believe nurses are really on this precipice of this like perfect operational leader because we just deal with it naturally. I mean, we don't look around and ask someone to put out the fire. We're already grabbing all the tubes and things we need instantly because we know what care looks like and we know what optimal outcomes look like. So I use that energy also as an investor, as an entrepreneur, really trying to find those fires. What can I mitigate? What are the risks? What are the safety? What are the outcomes? I mean, I know you heard that in nursing school. So it's the same thing in businesses.
Yeah, thank you for first of all to put me in the same rank where you are. You are too humble. I hope so to be in the same rank and category which you are. It is interesting. So one of the things I see also, you had your education at Kent State University. Somewhere you mentioned you had your mentorship and you received a good treatment from them during their mentorship ship program, and that helped you to try to find your voice as a leader. So here I want to ask two questions here. First of all, because mentorship here sometimes coaching it's overused in our industry at least, and there is
Totally.
misuse for that. So as a one is not selling her services as a coach for someone take these services from other and during the academic setup, how you evaluate out of 10, mentorship, it's important to shape our skills and our mindset.
Yeah, I look at it in like a different mentality. Like when you get exposed to different caliber of individuals who not only have the intellectual capacity, the capital, the asset, like all those three hats. When I've looked around the room at different industries I've been in, I always wanted to find those individuals I've mentored because they've been through the trials and tribulations. They know the growth. They know what it means to have that tenacity and resilience that you need to maintain. And so I've had a mentor, one of my mentors has been in my life for 10 years. I was with her as an undergraduate student, and she's an attorney. She's an incredible attorney. She was a nurse, went that route, and has done incredible things for her career. And I thought, wow, that's exactly how I want to emulate my life. I want to be able to say I made this lasting impression. I have this unique skill set. I can use my skill set for such benefit and great, give back and give forward type of energy. And so I always found mentors like this constantly that could elevate me. And so I could elevate everything around me, whether it's serving people at larger scales, being able to refine processes, and ultimately deliver like an easier and better humanity, better, easier humankind. So that's like my biggest advice for mentor. Find a mentor, admire the shit out of them, and say, hey, I want to learn from you because that exposure is critical for success.
So from your mentor, who she is working as attorney, so you take from her the way how to communicate, the way how to position yourself, and that help you to use your voice as a leader. That's what I understand from you. So where you use your voice as a leader? Can you give me example?
And that's every day, all day, whenever I can. I feel like similar to you, and we walk into these new spaces, like whether you're in digital media, whether you're in innovation, you're probably one of the first nurses to do this.
Mm.
And it's growing, but the first of anything is so hard. You have to learn. You're learning for yourself. This is the first time you're learning something. I'm learning something. And so when you get that opportunity to be so vulnerable, take that power and give it and provide it to everybody and set the standard that nurses can do this stuff. And I look at to myself, whether I'm active on LinkedIn or I go to a nonprofit organization or a conference or anything local in my community, a nurse can do it. We do it constantly. And I just want to give that confidence wherever I go. And I hope you're doing the same. Really, all nurses should. You're so powerful as an identity, as an entity. And I want people to own that. So wherever I can, I try to elevate my voice.
I believe if you allow me, you need also to amplify and use your voice on the digital media across the LinkedIn. You are
Totally.
not active, but I believe you have a good positioning to present yourself as a leader, and we need such nurses like you to present us. I'm very proud to have someone like you to come and speak up. So LinkedIn, you have very powerful profile, but you don't post actively. So this is something I believe you need to consider.
Hey, thanks for the advice. It's hard too because you have this part of myself that is still so private and part of myself that is outspoken, right? And when you work in a lifetime of healthcare, there are part of you that has to turn off. And that is for me on social media. So there's times where I'm like, let's use my voice, let's advocate, let's talk about environmental changes or any social determinants of health that I feel compelled to. And then there are moments where like there's so much chaos in this world. I just want peace of mind for 10 minutes.
Yeah.
And I think we all feel that type of energy.
Absolutely, you are right. No doubt for that. I agree with you. So I would move about one of your hat. You work as a head of innovation. So what does innovation mean in the context of the healthcare delivery and the most powerful way to utilize it from your perspective?
Hey, love this question. Love this question. I love innovation because it's like looking at something and saying, I know where I want to get to. Like, I see where the solution is. How do I get there by breaking barriers? Whether it's personal barriers like implicit biases, whether it's physical barriers like technology or accessibility, you got to peel those layers to get to that solution. And we live in such a fun age where technology is hitting us from every angle and it's challenging educations, it's challenging processes and workflows. So staying on the precipice of those advancements is how I can see what's going on in the clinical space and where we're advancing to. Like we should look at any barrier and say, how can we eliminate that with modern technology and be those leading voices? So I look at innovation as like here's my problem, here's my solution. What is every barrier that's going to hit me, and how am I going to knock that down to get to what I want? So as long as you stay resilient, it's easier said than done. But if you stay resilient, if you stay up to date with technology, if you lean in towards anything as possible, then you will have success. So looking at that and looking at your own implicit bias and being like, I think I can't do it. Like, yes, you can. Yes, you can. Stay resilient. You can. And so that is what I've always used in my, I think, day to day, really is like my mindset moving forward, or has been the last 5 years.
When you mention right now, yes, you can do it. Who you are talking for? What is your audience? As nurses or those in the big corporate? You need to convince them. Listen, I am yes from the from the clinical background, but I know exactly how to make it. So who you are talking for?
Love it. Honestly, I'm talking to the person who is so interested in becoming an entrepreneur. I am talking to the person who wants to own a business, who wants to own something. I'm talking to you because I feel like a lot of what I learned from innovation is being able to have the autonomy as a nurse practitioner, to handle stressful situations and be able to hopefully handle them gracefully and finessely. I mean, that's all of our goals, right? And so if you have that spirit and you have that independent thought and that independent motivation, you can do it. I promise you.
Yes, absolutely, yes. So here the problem and here the solution, and you do the resilience. Okay. Can you give me one of those examples? I'm not speaking for your private side, for the public side, which you have. Any example you can share with us for any innovation or project initiative you had in the past and where you contribute?
Yeah. I can tell you one, and I can tell you kind of large oversight with it. Is one of the biggest challenges is, I think, in our social determinants of health is financial well-being. Like, I cannot stop advocating for it. And it's a systemic issue, because if you don't understand finances to the molecular level, it could predispose you to so many other challenges in life and complications and lack of access to resources. I mean, it's huge, right? And so I had the opportunity to work with a company that really advocated for financial well-being by finding individuals in the communities that could get paid for caring for their loved ones. And it was so clever, right? Anybody can become a home health aide. You can be trained in certain ways to be educated as a caregiver or of like certain sorts, and you can actually get paid to care for somebody. Think about that as a loved one. So if God forbid, someone got sick and you're around your family and you had to stop work, you can at least get paid for it to care for them and make sure they have good outcomes. So it was like an incredible CEO that I worked for. I oversaw all the clinical care, and I thought, what a cool opportunity. Here's a barrier, financial well-being. Here's a way to break it. Here's the solution. And the outcomes were amazing. Patients were able to get off the streets. They were able to have money to go to grocery stores, to go out to the movie theaters. Night and day changes, all because we were able to pay them. And I thought, that's amazing. There's a barrier we all thought existed. It actually doesn't.
If this is through the services or platform and technology, I don't want to get more detail, but
It's okay. It's a little bit of both. It was both health tech and SaaS, kind of a little bit of both platform.
absolutely, absolutely. So, besides you are advocating for well-being, also you are advocating for patient right, and you have written for importance for emotional safety and healthcare provider. And this is just one of the examples you just mentioned right now. So, why emotional and well-being is a critical healthcare, and what strategies do you recommend for organization and decision maker? Because you are the a leader to speak for your peer to take in consideration for their stuff. We hear a lot of advices and recommendation, but none of them it's work. None. So you bring something innovative.
I love it. I love it. I always like to study markets. Look at the full market, and from look at it from a business lens, right? So, because like emotional well-being, psychological well-being, all these well-beings have a full market space in our US and global economy, right? So look at it in a really big perspective. And where are we shifting to? And what is easiest shift for us to do that gives good outcomes? And in today's market, like if you look everywhere around the world, you're going to see something about AI integrating. And it's a good thing. We should have these tools. It is breaking barriers. It is getting access to care. It is doing better well-being, right? Yes, there needs to be parameters, but until we figure that out, there's a whole bunch of innovation innovation happening. So I instantly drawing to the well-being of others. I'm a nurse, that's to my core, but there's innovative ways that we can do so by studying market trends. So we know market trend is AI right now. We know market trend is like, how do we get to FDA approval quicker? How do we get drugs on the market quicker? So like the research end is also being influenced in this. And then the academic spaces, I mean, take it 3 steps. Every place that we interface is now using AI for complete interoperability efficiencies. And I'm so excited about it. Like, let's move faster, right? As a country, as a world, let's move faster. And if we can cure diseases quicker, if we can solve well-being problems quicker, like why the hell not? Why wait 10 years when this could be a 6-month project? So it's understanding all those hats together is like really what's encompasses me to assess what financial, emotional well-being really is and how we can solve them. And I always encourage people like trend these too. Like if you have something you're really passionate about on the global and US market, you will then start being on the precipice of what's coming next because you're seeing those trends.
Interesting. I like it. Very important. I believe something will happen between me and you offline. But now back for our agenda. So you are talking for me from entrepreneur and investor mindset. Now I am a CNO. With
Okay.
all respect for all the leader in the healthcare sectors, they are very qualified and sometimes overqualified when it's coming for technical skills. But what's coming soft skills, innovative, bring a new solution, solve a problem, still till now, I don't want to be subjective worldwide. From my experience, at least they try to solve today a problem with yesterday tool. So
I
for
love that. I love that you
yeah,
just said that.
yeah.
Hey,
So
get
what's your advice for them to make sure, because they keep complaining and they keep saying we have shortage. Our attention, we need to improve the retention. Okay, but we don't do anything for well-being for your staff. Okay, then they thought beat the party, take off, don't come to the night shift. This is one of the nice things to have, but you need to be sustainable to do that. So for sure, you know more than me on about in this context. So tell them what is the trends right now. They can utilize it for their own benefit to improve the well-being for their staff.
And you bring up 2 problems, buddy. You bring up like 10 problems. Let me go through them. One thing, okay, so why is it every CNO is in the hospital? First off, like we should just like not think of hospital-centric culture anymore. Like nurses do not need to just funnel themselves, starting them just in the hospital. There's that one space, but CNOs can be literally anywhere around the world. They can be in every business, they can be anything that involves serving care, humanity, people. They don't need to just be hospital. And that's probably, I think, their biggest issue with solving the work retention issues, these pizza parties. I mean, everything I've like 10 years, I still hear the same stuff. It drives me crazy. The bigger issue is that there isn't other spots for nurses. We haven't opened those workforces. And so our hospital centric culture is a systemic issue. There's a whole system problem here. You work 12 hours, you're tired, you're burnt out, you're short staffed, patients are more complicated, you lack resources. I mean, let me list the problems, right? And I don't know if solving it is like layer by layer. We need to just change the whole system, like how we envision sickness, how we treat ailment, what is primary care, what is primary prevention. Like we need to fix that so then we do fix the hospital culture. And then we don't have to funnel nurses just into the hospital mindset. We can say, hey, you know what? You're going to go run a podcast one day and you're going to get 1 billion followers because everyone's going to want to hear what you have to say. I want that energy for the next generation of CNOs. And I want them to look at other industries that have had these challenges. We're not the first workforce to have these type of disruptions happen. I mean, government's having them now too. Like other industries like venture capital is having them too. We're all having them. How did they get out of them successfully is how we should model them. So that's my hot take.
Yeah, I know it is the easy to say this, but sometimes it's hard and the change, especially in the healthcare sectors, we intend to take this any change very slowly and slow down any change. And we intend also not to adopt any technology every time. Till now, they thought that we thought the EMR is the best innovative ever we have. However, it's not anymore. Still is not user friendly till now. It still is taking more time. I had experience during one of the project of implementation, and out of the blue, for a surgeon came for me, and he is not aware I am working on the implementation for this software. He is not aware at all. So he told
Okay.
me, "Do you believe that?" I told him what I believe. He told me, "I am a surgeon. It's easier for me to go and open the abdomen for my patient and do my work better than go and do the documentation there." I told him why. He told me, "I spend more time in documentation more than I have to give for the patient on the theater."
Amen. We know.
We know that, but still till now, we have, again, as I mentioned for you, we try to solve today issue and tomorrow issue with the yesterday tools which we have. And because we don't want to use something still not evident basis, not experimental. Okay, let's go and do it together. Let's find it away. Yeah, I do agree with you. And I believe the AI, it's taking a place very soon, very, very, very soon, especially for certain specialty. It's not our topic today, so I want to listen from you. And I believe you somehow cover this question, but I will ask you maybe if you have more context or that you need to add it. So from your perspective, okay, if you are the decision maker in the hospital and you want to improve the employee engagement, the staff
Okay.
engagement, and decrease the burnout. Okay, with the limited resource you have, okay, we don't think innovative. With this resource you have from your leadership skills, I believe you have something. Maybe you can add it more than what we have because you are now out of the box. It's easier for you to find the problem and diagnose the problem more than who is on the problem itself. So maybe it looks silly, but this is the reality. So if you are a CNO or a leader or a decision maker and you want to improve the engagement and decrease the burnout, what you will do?
If I had a magic wand, right? If I could just like magic wand this real quick. I think one of the things that I think is a theme is like the lack of acknowledgement is like the big asterisk here, right? Like I remember in those times where I was in the hospital, like very rarely I would get a thank you and I would take people from the ICU to the hospital to like outpatient, right? So like I literally saved your life, right? And I never got a thank you. Maybe I never needed a thank you from the patient. It would be from more from my like colleagues and my employers to just say, "Hey, thank you for doing what you're doing. You literally saved a life." It was like those reality checks we never really got. It never really brought down to earth because I'm just, okay, what are the numbers? What are the pumps? What are the meds? What is this? What is this? I didn't even get time to smell the roses. And I don't think my employers ever gave me time to smell the roses either, right? I mean, you did ICU, you know exactly what I'm talking about. You literally saved lives. And I don't know how many people recognize that. And so we have other awards. There's like Daisy Awards and there's unit awards, but it's like, I think nurses should be getting Nobel Prizes. How many people did you save today? I look at my ER nurses, I'm like, you probably saved most of half of Texas, right? I wish we had more acknowledgement and more hype in our culture, like all of nursing, to look at them and be like, that's an incredible nurse. Look at what they did and have that verbose, spotlight on them for a change. I feel like medicine always gets the spotlight, research gets the spotlight, but it's like the nurses who I feel like we need to do a better job at like elevating them and show them. Like a huge PR campaign for nurses is what I'm here for.
I like it, to be honest. I think they did something like this during the COVID and Corona in some countries. There were both
Sure.
social recognition for the healthcare sectors overall, and they put their poster across the billboard on the street and put some fact about them and what they did and how they saved us. So this is something very important. Yes, it's you. You helped me to bring a new question for you. So here, from your experience, okay, out of the healthcare, let's speak business. So
Okay.
as
Big business.
someone work on and as a visitor, and someone work as innovation and a corporate, there is myth that if we need to decrease the turnover and improve the retention, one of the most important things to increase the salary. Yeah. And if we increase the salary, we will decrease the turnover. What do you think about that?
Hell yeah. Hell yeah. Invest in your nurses. What do you mean? Invest in the economic need for nurses.
Yeah.
But then this is what I would tell you, who pays? This is the big asterisk in this is the contingent part of this conversation. Who pays for nurses? Is it a governmental aspect? Do they need to invest more money in nurses, both in Medicare and Medicaid reimbursements? And does that include inpatient facilities? Because right now, inpatient nurses are not revenue driving. Indirectly, yes, but not directly. There isn't like a unit economic for nurses for
Mhm.
inpatient side. Outpatient has them for sure. We see them in home health and home care. But or does the payers pay? Should all the big, payers, United, Anthem, Blue Cross Blue Shield, should they pay more? And does that cause some like nepotism and some issues with certain third parties having that leverage against our workforce? I mean, this is like the bigger conversation is the unit economics behind nursing. And it hasn't been that study. There's a lot of good groups right now that are really leading the charge of what is the finances behind nursing and where is the unit economics behind us? How
Mhm.
much do we actually save society? And I think if we can put a dollar amount, which I hate, but if you can put a dollar amount behind us, I think people would see our worth more.
Yeah, absolutely. My
You know?
question, I am an allude for something else. I agree with you what you are mentioned. We need to
Okay.
increase the salary. But now, let's take this simulation. You are my
Okay.
boss. I work with under your supervision. We don't work in the hospital, just to make it easy. You are pussy. You are toxic. Sorry for that. Okay. So I care
Okay.
for you, and I told you I need to leave. So you increase my salary with generous anger. Okay, but I told you my concern. Yeah, thank you. It's good, will help me, but I don't feel safe. I don't feel appreciated. I am overloaded, life work balance, all those things. Let's help work together and help that because if you give more money, that you know my value. So please improve my environment culture. But you kept everything's as is, but you increase my money. Do you think I will stay? Maybe I can stay 1 year extra. Do you think I will stay with you forever?
No. I think if you work in a toxic environment that you don't feel appreciated, heard, validated, that is the emotional part. If you do not have that, no money in the world will give you that satisfaction.
Yeah, my point from here, what I see, all the leader they try to solve one issue and forget all the other factors, which is something is it is complex issue. We
Totally.
tried this in different way for long years. We need to take and tackle all the root and solve them together. So this is my point. Yeah, for sure, we need to appreciate all the healthcare care provider and also nurses, one of the most important underpaid. And also we have other profession. Also, we need to consider that, but also the environment itself. The way one of the things I keep hearing it from my guests and the podcast. One of the things they have it to there's no clear pathway how they will get on the ladder for the next level. It's more
Sure.
about seniority and my self-driven. So a lot of the things we need to do that. And why I'm putting this in front of you, because I believe you work with a lot of new innovative ideas, startup, and here we will care for the beauty part, which I like it. And this is where till now I don't see anyone as a nursing background play role as angel investors. So tell me, as angel investors, how you get there? It's for me. I know this is something. It's not easy. It's need big muscles.
Yeah. So I think I I love the art of angel investing. It's really an art and a science to me. You probably have already gotten to know me so much already in this time that we've been together is that I've done the academic route, I did the hospital route. I went there and I felt like I would sit through 700 meetings and nothing would change. I hear the same thing you're telling me today that I remember 10 years ago hearing about it. And to be honest, like 10 years have passed and we have not evolved. And so I thought, I'm going to put my money where my mouth is. And if I start investing, I will see better outcomes. And especially if these CEOs are incredible and they're intelligent and their expertise and they want to drive a business this way, I will invest in you to make that impact. And I know I can help people more. I had like the opportunity to go through an acquisition with one of my former companies. And once after that, I realized that company did so well at providing mental health for people who didn't have access. And then I knew I had the ability and privilege to be able to keep paying that forward to other spaces. And I primarily invest in healthcare, health tech, biotech. I've always been under that umbrella because I can understand it. I see the problem. I've seen ways people have done it. So I get this first hand angle. And then I get this part that is super researchy where I'm like, okay, tell me about the market. Tell me about the issues. Tell me about this, that, the other, and compare them. So there's this like huge comparative analysis that I love that thrill. Excuse me. So I go from this part where I assess the market, I do this comparative analysis, and then I really love to learn who the founders are and who the CEOs are. And I'm like, wow, your heart is in such the right place, and you have your story, and you have your mission, you have your values. Now you're three checked investable to me. So I look at that and I think that's the art of angel investing, where I look at the full picture, the full clinical synopsis, and I know that this will be a good outcome if I invest in this way. So it's been a combination of a learned lesson and a growth opportunity, but to be able to see those come to fruition was worth every investment.
Yeah, I understand that because I had this journey by myself, and I know how it's hectic and risky to have it as a one startup to work with that. But I can imagine yourself how much will take time and effort from your socially and mentally in order to give this attention. Especially you need to know where to put your money and to invest. And here we will go for Samsung, the market, all of those things. Okay, maybe it's clear for me, but that not necessarily also everyone it's have the what you are doing. So you're doing something it's untraditional at all and very rare and uniqueness that they have. So tell me how your day to day look as investor or angel investors. What is angel investors and what they do?
Oh my God.
Simple word. Simple word.
Oh my God, you don't wanna see my schedule, I promise you. It's wild. It's like a 12-hour day every day. I'm very disciplined and very routine. I have a structure and I keep to it Monday through Friday, and Saturday and Sunday, I am on off mode. So it's like having that healthy balance, but I give everything my 120%. I keep my body, mind, and like emotional, psychological well-being very healthy, because if I'm healthy, the ones around me, I can maintain health. I'm a mom, I'm a wife. So for me being the pillar and that infrastructure is so important to like my home and my well-being in my home. And I keep myself involved in unique and like conversations. If I can go sit into something that I don't know about, if I sit on these webinars, if I go to these LinkedIn events, if I go to these events and I travel to SF or go to Boston, I'd always keep on the precipice of what's going on as much as I can. And that's what it looks like to be an angel investing, is kind of a good networker and a disciplined, it does discipline and resilience. Like those are the three hats I think I wear constantly. And that has ultimately has supported my journey.
Do you practice your behavior as angel investor on your kids?
I can imagine. This is a great question. Yeah, I teach a lot in like as I am as a human. So I can imagine my kids are like, yeah, mom, I'm studying markets. They probably learn a lot from me in that way. Yeah, and I expose them to everything. So if I get the opportunity to take them to something, show them something, like hell yeah, they should come. They should be exposed to these type of conversations and these environments so they can rise higher than I did. And I want that energy for my babies just like you would want that energy.
Yeah, yeah, absolutely. They are like having you. They should be proud to having you as a mom. So one question here for you: what you do or for early stage companies or startup? What kind of support you give for them along with the funding? So
Yeah,
as a rich investor, you give the money. What else also you give?
support. In all different type of ways. I've had companies where the CEO calls me for like mental health support because they just need that type of love, and then other ones that need strategic clinical advancements, and it's sometimes all the above, right? I like to just be their friend. Like I see their mission, I see their reason, I see their why, and if I can help, the door is open. I invested in you for a reason. So whether it's like you need to call me because you've had a shitty day and a million venture capital said no to you, call me. I understand. Sometimes it's challenging. I've been in those, I've been in that beat. Or if you're like, hey, what do you think about this new market trend hitting healthcare? call me. Happy to have that 15-minute conversation. I think this is mentorship, right? Especially the new generation. They need to see how things have done to be able to be successful in the come up. So you leaning on me is something I'm okay to like receive and give back. So I feel like in all the investments I have, most of the founders I'm actually friends with, and I wish nothing but everything I can give to them in all the hats I wear.
Absolutely, absolutely. I can see and feel your energy for that. Knowing that, and for sure you know more than me because you're in the domain, why most of the clinician overall, they have idea, either they don't think how to implement it or scale it up, okay? Or if they start to do their own business, they felt quick enough before they just publish their website. What is your advice? Why they are failing? I know this is something normal in the startup, but why the failure rate on among the clinician higher than any other industry?
Great, great question. Startup is very volatile, just like you said. A lot of people within 2, 3 years have already either filed for bankruptcy or they won't press forward. A couple things come top of mind. Like, what is a scalable and non-scalable business is probably the first thing I would thought of. There are a lot of clinicians who come out in all sectors who are like, I'm going to start a primary care clinic. I am going to start this. I'm going to start my medical specialty job, right? And if everything is on the ground where like your clinic is in a localized place, your infrastructure is in a localized place, your marketing is in a localized place, you've narrowed your total market. And if you really want to scale, how do you scale yourself? I teach this constantly to clinicians. Like, you're a very scalable human. You just don't know it. Are you licensed in multiple countries? I know you are. That means you can open two different markets. You are very scalable. Are you licensed in all 50 states? Can you see adults and can you see pediatrics? Now, do you have the technology to handle that type of infrastructure? Now I start talking about vertical and horizontal expansions for
Wow.
clinicians. So when you think about that, you are very scalable. We have just had this one-minded centric culture that you're just going to go work in healthcare and that's it, versus you can take over an industry. You literally can. And I'm licensed in 10 states, so I know I can hold those markets in 10 states. That makes me much more marketable, both as a clinician and both as an entrepreneur for many different reasons. So I always try to tell my clinicians, how scalable are you? And if you want to be scalable, put yourself out there to be scalable. And understanding multiple markets is probably crucial. So when they get out of school, and I see ones that want to do in biotech and they want to go into those spaces that can have those scalabilities, do you know the other economic businesses or economic industries? And Canada is very different than the United States and how we handle care, right? And so if you know those differences, you know where your barriers are. That's why a lot of businesses in the United States that are healthcare actually go to places like Singapore and Australia, and there's reasons behind why they do that. And so recognizing those and studying those and understanding those make you more scalable. And sometimes I think clinicians don't see that until they get that like light that goes off in their head and they're like, oh yeah, I can do this. I just have to apply and send my license and send my background check. Then you're scalable.
So logo is not my big deal to consider when I want to open the business.
What did you say? Say again.
The logo, ironically, I'm sarcastic. Logo is not my big issue to consider and spend time on my logo and the color. There's more things to consider and educate myself to understand the market more than the logo. Because what happened? Because they are too into it and they like it and they live it, they fake it. I like fake it until you make it, but not in this way. So you need to make sure you live that, but you need to prepare yourself. So they thought, now, oh, I'm ready. I go for the market. Just now we need to tune our marketing messages and our logo. This is most of the time where I see at least who is around me. They taking care most of the time on the logo.
Totally. And can I tell you, your company will prevail if you prevail and you're investing in the right things internally. So like if you get funding, whether you're venture backed, you've done angel investing, you've already grown your revenue, where are your resources should be used the most, right? And that's kind of an internal assessment every entrepreneur needs to do, every investor needs to do. Where should you put your resources first? Some would argue marketing, sure. Some will argue operations, sure. I think all the arguments are fair, but what is needed for your business and for you to scale, you need to have that deep dive before you start putting money elsewhere, like into a logo or other areas that may not just be significant at this point in your business.
You have mentioned something. I try to use your word, but you have mentioned something why we direct nurses to go for the hospital only. So there is another places there. So why is mentorship so important for the healthcare, and how can more experienced professional can give this for the next generation while they are on the school?
Yeah, that's a great another great question. Like it's my why, right? I really wish I had someone like me when I was in nursing school to be like, "Hey, you're an entrepreneur, you are an investor, you need to go this route and open that door." I had to learn kind of the hard way. And a lot of time in nursing, we are kind of learning the hard way, and I don't really like that about our culture either. But I had mentors who pushed me into directions and exposed me into other directions that I don't think I would have had the opportunity to if they weren't. So having mentors is crucial for like the exposure that you will have in your growth periods. And every stage of my life, even actively now, even as a mom, as an entrepreneur, investor, I still have mentors. Like I have mentors that I've seen do and grow $100 million businesses. And I talk to them every Monday and I give them 15 minutes of my time and they give me 15 minutes of their time. And because of them, I owe my success to my mentors. And I give them my love. They come for dinner. My home is open to them and I vice versa because we've developed a mentorship that I know that they've invested time with me and I appreciate that. It's crucial, I think, for success.
Yeah, lovely. And I'm pretty sure your mentors, they are superstar for having someone like you. So I imagine the knowledge and skill they give you, so they doing very great job. I had mentor and still I do mentoring with some. I hope to come across some mentor like what you had in your career. So because I realize the value they added for you. So what what you will say for that stereotype? Okay, now we study or we teach them nursing because we need to cover the gap on the shortage on the healthcare system. So, how you want to encourage them to think out of the box, to go out of the hospital or the healthcare system because we need them. So this is will not happen. I will give you a funny story. My mom till now she don't know what I'm doing till now. Since I left the hospital, she don't know what I'm doing. Every time she is not aware about that. So as a family, with all respect for them, as a healthcare system and healthcare education, all of them, they want us to stay in the hospital. You and me, we want them to think bigger. So what you will say for them, why you encourage them to leave the school to go for something beyond nursing?
Wow, that's a tough question. The reason why we have hospital centric mindset is because we have sick society mindset. Our society, our population is getting sicker. We all know this. And so we have to have this mindset because this is where the current need is. Like I salute CNOs of hospitals because you're solving a huge issue, workforce shortage issue, sick population issue, staffing issues. Like they're solving like the world's problems all into one little entity. So I want nurses to fix the bigger problems, which is outside of the hospital, like preventative care, functional care, medicine 3.0, technology care, barrier care, like all that stuff a nurse can do. So if they invested time outside of the hospital, we won't have the sick culture mindset. We would have a prosperous mindset where we would look at sickness as I don't want to be sick. I have the resources to get out of it, or the resources were delivered to me to get out of it. Yeah, it doesn't fit the bill. I know this is like super oversight and goal, but I think nurses knowing how many things and touch points we need for one patient to be successful, we can take that similar concept and drive it into a business. I know the one thing that would make all these patients better, go build a business off of it. You probably have done it 60 times in 1 week, go build a business off of it. And then that's investing in nursing. Like that's investing in nursing. I want us to be investable. Can I coin that word? Nursing is investable, period. I want to live a world where AI leads, but care is what shows. And that is from a nurse. That is not from a machine.
Yeah,
There's
interesting.
my
Yeah.
soapbox. There's my
I
elevator.
believe there is something there. It's happening. As I told you, I believe something me and you need to discuss about that. But
Definitely.
yes, I see the way how we need, I think, someone like you who is on the market and as a leader, and you have your own voice and being educated how to use your voice. I think we need to educate the leader, decision maker, and the policy maker in the health to know, okay, they are not on the healthcare system, but still in the hospital, but still we can use them on the healthcare system. Public health, infection disease, everywhere, technology, all of those we need those technicians to come with us. So we need to
Oh,
think not narrow for the solution. We need to think about that. But I believe they will understand this from someone outside easier from someone inside. In the hospital, it's like the army, the hierarchy structure. It's ranking. It's easy to do that. And also started to see I have a live next week with my friend Jennifer. Sorry, I Jennifer Taylor. Jennifer Taylor. Okay, I'm very bad with the family name. Jennifer Taylor. She is a engineer. So
okay.
she have a passion and she have initiatives in LA. And since long time they are working on co-housing and co-living. So she take the Maslow hierarchy and pyramid to
Okay.
start with tier one, tier two, tier three. So we on the tier three as managing the disease. So we need to take care for the fundamentals. So this is the things where she tried to advocate, okay, in order to prevent disease for us, better than manage the disease. So there is a lot of initiative, but I think some of those movements we need to work together because part of solving the problem to make sure we solve the root. We try it, as I mentioned, since long time. So, and I start to see also non-clinician get into the healthcare system because they believe they can contribute in this, and they see the situation is very chaos, and they want to improve it. So, thank you, Jennifer, for your initiative, and follow us and watch us on next week. On I think we are on Thursday. We will go live. So, last question for you here, and after that, I want to see, okay, let's put it in a different way. What is your top tip for the balancing a clinical excellency or a clinical experience with the leadership, research, and advocacy?
My top tip. I believe in kind of three hats. Know the intelligence, gain the capital, own the asset. And so if you can wear I know, don't I sound like an investor? There is one thing I could give advice. If you triage, if you act in those ways, you will be very successful. And you can balance both of those worlds with such finesse and grace. And I think nurses are already predisposed to think and act that way.
Yeah. And I believe, to be fair, because my intention from this episode and bringing you to give the tactical and strategic technique for the new generation, how they can take their skill set to scale it up for their benefit in the future. And you are the good example to do that. So, as a final question from my side, okay, what is your advice for the nursing and healthcare professional who want to impact beyond the bedside? So, how they can step out to build and grow their career to become innovator?
First step is market yourself out that you are an innovator. But market yourself out to the way the public sees you, not necessarily the way you see you, because you may see yourself as an innovator, but does the world see you as an innovator? And how do the world sees you as an innovator is there is social media, there is publications, there are being disruptive in certain markets, going to those spaces and disagreeing. So if you can market yourself out there that you have the solution and you know it, you will lead in that way as an innovator. Because in nursing, that's innovation in itself.
So, and here we can see one of the things you mentioned, academic publication. We can use it for our side, and I believe they are brilliant that they can know how to do that. There is no word to add more that, but social media is underestimated. They don't know how they can, yeah, how can they use it for their
Totally.
own benefit. Jasmine, from my side, I finished my question.
Macy, is this your baby? Hi, you are so cute.
Super.
Hi, baby. Oh,
I am very bad in the question, in the family name, as I told you, but you have a question, not from me, from Susie Prangana. Susie, she was my guest, and
Okay.
I start something new. So, and I will ask you the same things. I ask her, give me a question to ask by my new guest.
Oh,
And I told her I don't know who my guest will be in that time, and because I don't know my schedule. So she gave me a question.
okay.
The same things.
It's okay.
Okay, Baba. The same things I need to think about the question to ask for my next guest for you. But your question from Susie. Okay, what are you doing in your current role to make sure that you are taking care of yourself and that you are healthy?
Whoa, what a question. Whoa. What am I doing? Everything I do is I do it because it makes me happy. I do not do things that do not make me happy. I'm no longer in that space to appease others and like appease the surrounding. I'm acting in good intention of what I need and what my needs are and what makes me happy. So I would answer it that way. And then
Yeah.
my question to the next person
Yeah.
is, what are you doing to keep yourself happy?
Oh, new question we need.
But that can be defined so way. Okay, my new question is, how are they defining happiness?
Okay, good question too. Yeah, it's good question. Thank you, Jasmine, for your time. I really enjoy. I learn a lot from your insight and perspective. And I will share your social media account and your LinkedIn. So anyone want to connect with Jasmine, I recommend that. Do that immediately. Don't wait. And also, if you have idea and you need to validate it or need any help, Jasmine, she is the right place to do that. Jasmine, how you want to end our episode?
Thank you so much for having me. This was just fun. And it was so good to connect. And thank you for doing what you're doing. You're an incredible nurse. You're incredible nurse innovator. So, like, thank you for carving the space out for nurses. We need more people like you. I promise you.
We need people more like you as well. Thank you. Thank you for your time. See you soon. Bye bye.
If this episode sparked something in you, here's how you can keep our mission alive. Subscribe to Uncharted Narratives Certiat. Leave us a 5-star review. It helps more amazing people discover our stories. Share an episode that moved you with a colleague or friend. Connect with me on LinkedIn and join our healthcare innovation community. Together, we're not just telling stories. Until next time, stay curious, stay passionate, and keep pushing the boundaries of what's possible in healthcare. See you in the next episode of Uncharted Narratives Certiat.